Bulavinaka members of the media, and thank you for coming out today. As we speak, our immediate situation overview, or what we call ISO in short, is leaving to carry out assessment for Kandavo to get reports on the ground. The team consists of communication specialists as well as logistics specialists who's going to try and make contacts with our people from Kandavo. We hope within the next 1 hour or so we should be having communications with our people from Kandavo to ascertain the damage that has incurred to them by TC Harold. I also wish to convey my appreciation to the Government of New Zealand as they have provided a P3 Orion aircraft to take aerial images on the affected areas. Upon the approval and the presentations that was done this morning to the Honourable Prime Minister and members of the Cabinet, our initial damage assessment team will be carrying out their initial damage assessment on the ground as we speak. Today, our Prime Minister will also be visiting some evacuation centres in the Central Division, while our team will continue to work with Ministry of Health officials in making sure that COVID-19 protocols are being followed in the evacuation centres. On situation reports in the last 12 hours, public movement restrictions has been uplifted, but COVID-19 curfew remains from 8 p.m. to 5 a.m. A total of 197 evacuation centres remains open, with 6,240 evacuees in this 197 evacuation centre. Operational focus for the next 24 hours for your National Disaster Management Office. Public safety remains paramount. NEOC will continue to provide situation reports to the public as well as to the Honourable Prime Minister, monitor and provide updates of evacuees in active evacuation centre in ensuring that we adhere to the protocols of COVID-19, coordinates with divisional and district emergency operations centre and first responders in our effort of recovery. Because we have TC Harold has passed, we wish to remind the public of a few good practice hygiene. Avoid contacting or spreading disease by washing your hands with soap and water, and seek medical attention if you have developed any symptom.